My name is Vincent Conley. Today's February 25th, 2021. This is my coronary heart disease passion project. This project is over coronary heart disease. This project will go over the history of CHD and the important people that were involved in it. This project will also go over the data and statistical side of coronary heart disease. A career that is connected to my topic is cardiology. A cardiologist is a doctor who specializes in the study or treatment of heart disease and heart abnormalities. Cardiologists are becoming more and more popular as technology advances. To become a cardiologist, you must first receive a bachelor's degree. After your bachelor's degree, you are required to have 4 years of medical school, 2 academic and 2 clinical training. Then you need to acquire a residency in internal medicine, which takes 3 years to complete. And finally, you need to have a cardiology fellowship, which typically takes 3 or 4 years to get. Coronary heart disease goes back to the ancient Egyptian era. Their diet of fatty and salty foods resulted in most Egyptians dying by CHD. Throughout history, we have studied coronary heart disease. Leonardo da Vinci is responsible for first discovering coronary heart disease. After da Vinci's discovery, many people sought out to learn more about coronary heart disease. Not long after, inventors started to create ways to treat coronary heart disease, as technology advanced, so did CHD treatment. Leonardo da Vinci, 1452 to 1519, investigated coronary arteries. William Harvey, 1578 to 1657, discovered that blood moves around the body in a circulatory manner from the heart. Friedrich Hoffmann, 1660 to 1742, noted that coronary heart disease started in the reduced passage of the blood within the coronary arteries. William Osler, 1849 to 1919, worked extensively on angina and was one of the first to indicate that it was a syndrome rather than a disease itself. Angina, the tightness in the chest that's often an indicator of ischemic heart disease, puzzled many physicians in the 18th and 19th century. American cardiologist James B. Herrick, 1861 to 1954, concluded that the slow, gradual narrowing of the coronary arteries could be a cause of angina. The 1900s marked a period of increased interest, study, and an understanding of heart disease. In 1915, a group of physicians and social workers formed an organization called the Association for the Prevention and Relief of Heart Disease in New York City. In 1924, multiple heart association groups became the American Heart Association. Just a few years later, doctors began to experiment with exploring the coronary arteries with catheters. This would later become left heart catheterization within coronary angiograms. In 1958, F. Mason Sones, 1918 to 1985, a pediatric cardiologist at the Cleveland Clinic, developed the technique for reducing high-quality diagnostic images of the coronary arteries. Now we see heart disease prevention as a worldwide spread, and technological advances are happening almost daily. Coronary atherosclerotic heart disease remains the #1 cause of death, disability, and economic loss among industrialized nations. Although the primary focus of care for patients with atherosclerosis is prevention of disease progression by risk factor modification, management strategies for symptomatic patients include both pharmacological therapy and revascularization by either percutaneous coronary investigation or coronary artery bypass graft, CHBG surgery. CABG surgery was introduced nearly 35 years ago, and it has become clear that this operation relieves angina pectoris and likely improves quality of life. Coronary artery bypass graft surgery, CABG, is the most common type of heart surgery. More than 300,000 people have successful bypass surgery in the United States each year. Accesses in CABG have helped better society nowadays and helped so many more people nowadays than in the past. In a little over a century, heart surgery has gone from prohibited to commonplace. Major advances have made the CABG a much safer and more accepted procedure. Continued research into different approaches, methods, and medical interventions may make cardiac surgery less invasive and safer for society in the future. So this is the data. Here are my data calculations. The death rate of coronary heart disease started at 56.25% in 1203 BCE and has now decreased over the years by 41.3% and is now at 33%. This is due to the invention of medical preventions and advancements in technology. Surgery death rate started at 13.51% in 1938 and has now decreased over the years by 85.1962% and is now at 2%. This is a result of technological advances in surgery that makes the procedure safer. Cost of surgery was $1,051,271 in 1938. Over the years, surgery has become more acceptable and cheaper because of the increase of heart surgeons and medical equipment. The number of people killed annually started out as 15,187,500 and is now at 8.1 million per year. The annual funding for coronary heart disease prevention in America is $219 billion. In conclusion, coronary heart disease has been around for a long time. Ever since we discovered it, we have been trying to find ways to prevent and cure the disease. And as technology has evolved, we have gotten closer and closer to curing this disease altogether. We have seen through the data that we are slowly putting a stop to coronary heart disease deaths. We have also seen that as we make cardiovascular surgery more common, the cost of surgery goes down. One day, we will no longer have to worry about coronary heart disease. The cure will be accessible to everybody, and deaths due to coronary heart disease will be absolutely no more. And these are my citations. Thank you.